Hey y'all. So today I am going to talk about my C-section recovery as of a year and a half later, and what you may expect, what you may not expect, because your body is different than mine. So this is my experience. This is different from the other people that I see on YouTube where everything's all snatched back. Snatched, right? Mine's, it's kind of like, it's trying to snatch, but something got lost in translation, you know? That's my experience. So, let's start off with, why did I get a C-section? So, it wasn't my choice, per se. It was an emergency C-section. I can leave the video down below. It was an emergency C-section where she had meconium and her heart rate was declining, and it wouldn't stay up, and it was just going down, and then they broke my water and she pooped on the inside. That's the meconium. I'll leave it down there. So they had to hurry up and get her out of my body. And so I contributed to partly the epidural, because epidural does cause added stress, which also caused the baby's heart rate to fluctuate, and so that's another story in itself. So the reason I had a C-section was because Amelia's heart rate wouldn't be steady, and it just kept declining, and then she pooped on the inside. So that's why I had an emergency C-section. Do I regret having a C-section? It was no choice. So it was not really like, do you regret it? Because it's not like I had a selective C-section. I went in for a regular vaginal delivery. That's an apple in my drink because I'm thirsty. I went in for a regular vaginal delivery. That didn't happen. I went in with the plan of not having any epidural. That didn't happen. So sometimes your birthing plan doesn't happen the way you want it to. So keep that in mind. So expect anything to happen. Expect your birthing plan to even go out the window. I was 5 centimeters dilated, almost 6. The pain wasn't that bad. It was a miscommunication, yada yada, epidural. In the end, I got a C-section. And then during the hospital visit, so for me, when I went to the hospital, had the C-section, they said, okay, we need to get you in. We need to hurry up and get you to have a C-section done. And so what they did is they got me ready. They got my hat on, and they, you know, got Chris's hat. I had a blue one. He had a red one, so he got that. They wheeled me down. I guess this is normal. They take you down to the surgery room where everything happens, and then they get you cleaned. I guess they shave. I don't know what they do down there because I couldn't see, because they have this blue thing that's covering you, or blue, white. It was covering you. I don't remember the color. They have your arms out. They had it out like that. Some people say they have their arms strapped. Some people don't even have their arms tied down. They held me. I wasn't flaring. I wasn't doing anything like that, but they held me down. And so that was that. Yeah, I didn't like that at all. I was like panicking because my fear was I'm going to have a C-section and I'm going to die. That was my fear. I'm going to have a C-section and I'm going to die. Because you see how, like, people die having C-sections, and African American people or women, they die having C-sections. So I was like, I want to die. It was my fear as a child that I want to die and not going to be able to see my kid. So that was going through my mind. So they had me. They got the process started, and then they forgot Chris. So I was in there by myself, and so I was like, where's Chris? And they was like, oh yeah. And so they went to go get Chris, and then I was hysterical. I was crying, but I wasn't flaring. I wasn't moving. And then they got Chris, and then he came, and I still get a little emotional. So he came, and he said that I said it hurt. But I don't remember saying that. So probably because afterwards I just remember the doctor said, oh, we can't have that. So he got his little button. Just drugs. He knocked me out. After that I was knocked out. And so since I was laying on the ground, the room was spinning. After that, I remember Chris asking me if I heard the baby crying. And I said, I don't hear anything. I don't hear nothing. And I was just crying because I didn't hear nothing. And then they wheeled me to the room, and then they had me on so much drugs, like I was hallucinating. And it had an adverse effect because I'm little. I'm tiny, you know? Like, pregnant, I was 120. 120, maybe 125 if I had a big meal or something. But some of that weight had just delivered, right? It was just gone out of my body. They gave me the what was it? Oxycodone and some other stuff. I don't remember. And it made me feel very, very tired and sleepy, and it made me feel weak. It had this adverse effect, and then you're just so tired, and so it was hard to hold Amelia. And so after the couple of days, they say you're not supposed to lift anything bigger than your baby. So I couldn't lift anything. But I had internship, I had college, so I had to lift some stuff. But I couldn't lift. I did have a leave. I had my great manager at the time, and she understood everything, and just, you know, we worked it out. But yeah, you're not supposed to lift anything that's, you know, past your baby's weight. So technically you're supposed to keep moving. They say you're supposed to keep moving, keep working out, keep walking to help recovery process. And so for a while I laid out. I was in the hospital for about 6 days. So I didn't move that much because it was so painful. It was like hunched over. It hurt to get out the bed, and it was lucky because I had one of those, you know, hospital beds and up and down, so it helped. But it was hard. I didn't poop for a while. They make you have to go to the bathroom. So you have to go to the bathroom. So they give you stool softeners as well. So I had to go to the bathroom before they can release me. So it took a while. It took like 4 or 5 days. And then my doctor said, do you want to stay a little longer? And I'm like, yeah. Why would I say no? You know, because they give me free meals. Not that I'm poor like that where I need free meals. But it was free meals. On call. On their menu. Anything I want. I don't have to go to the store or cook. Right? And so they made enough servings for Chris. So word of advice, guys. If you are in a hospital and your hubby is there, your boyfriend is there, tell them that you want double portions. You can split it with your significant other or whoever's there with you, and just say, if they say why, this one the lady said, after all this, one lady on said, why, you're not supposed to have double portion. I was like, I'm nursing, I need my energy. Right? Who are they to tell you can't have two? Get your double portion. So that's what I did. I got double portions. So yeah, so keep moving. You have to use the bathroom. With the C-section, you still need pads. If you look it up online, people say get the pins, or the nursing for like the elderly people, how they get the pins. That didn't work for me with the C-section because they are very the elastic's not as stretchy as you would think, and it hurts. It just sticks there, and it presses on you. So what I recommend is use their chonies that they give you, because they have the extra. I still, let me show you. I kept them because I kept them because I could put them in the washing machine. So let me show you. This is what they look like. If you guys can see, it looks like boy shorts, right? But they're extra stretchy, like both ways, right? They're extra. They're comfy. So I use these when I'm on that time. But they keep everything together, and they stretch, and yeah. One advice that I want to give you guys, if you have a nurse that said they want to check your C-section before you, if your doctor tells you to take off your bandage in the shower, take it off in the shower, because it'll help the process of the sticky part to come off, right? I had the nurse, she had the audacity to say, I'm just going to check it. I'm like, okay, well, the doctor said I could take it off in the shower. She's like, no, I'm just going to little peek. And then what she did is she took it, ripped it off. Ripped it. And so on the sides of my C-section, I have blisters. So I have scars still. But anyway, That's my experience. So speak your mind. Say no. You're not touching me. No, the doctor said no, right? So that's one thing I regret not doing. So I don't know if that's a contributor factor to what I have now, but she ripped it off. So instead, there's you can get, for how they close you up, you can get stitches. You can get like dissolvable stitches, or they can glue. That's what I heard, they can glue. I had dissolvable stitches, which I heard with keloids. That's what I have. I have keloids. I developed keloids. So with keloids, the best thing to get if you are of African descent or Hispanic or Asians, which are more likely than to develop keloids, they recommend to get staples instead of the other stuff, because the staples, I don't know about what it is about the staples that's supposed to reduce the chances of keloids, but you can use that instead of, you can request it. I don't know how likely during an emergency, be like, hey, staples, because you know, it depends on your doctor and what they want to do. I had an on-call doctor, but yeah, I had an on-call doctor. Another thing I want to mention is I think my recovery time, because my recovery, they do initial checks. They check you to see how it looks after. I don't remember how long it was. I think it was like 2 months. They check you, and then they check you again in 6 months to see how it looks. So my scar looked the same, and she's like, the same as it does now. And she's like, oh, well, that's just the healing process. The swelling's gonna go down. They didn't even inform me about keloids and how to reduce it and how to like take care of it properly. Being of African descent, and the chances of me getting keloids are 7 times more likely, right? So, anyway, rant. So, my recovery process took a little bit longer because I was nursing, right? And my baby, she knew where to kick, right? So every time I changed her diaper, she kicked my C-section. She kicked it all the time. So I think that had an effect on the trauma of that area. So just, you know, protect it, right? Does it still hurt? Does it still hurt? Does it still itch? So my C-section, because it has keloids, it still hurts sometimes. It still itches sometimes. It's like, especially on the sides. Sometimes I get these like sharp pains on the sides, and sometimes I get the pains on the incisions. It still itches. And do you shave or wax? I trim, because I don't want to put any like blades next to it or anything like that. But it's still hard because the keloids that formed is not like a smooth keloid, right? It's kind of like, I can show you too. It's kind of like bumpy, right? So it goes like that. It's like, it's not smooth. It's doom. So it has these like these creases, just like your finger, right? Like it has these creases right in here, which makes it hard to get into, right? So I have to take a little something to clean inside to make sure I get all the dirt, so I won't get infected or smells or anything like that, right? And so the doctor, when I was in the hospital, they gave me a belly band, so that helped for the C-section part, but not the keloid part. So it helps keep everything tight, keep everything in. The downside with having keloids is, especially if they're bigger, on the bigger side, is that they catch on your underwear, they can catch on your pants, they make the pants uncomfortable because you're putting that pressure on it, and it hurts. You know, for me anyway, it hurts to have that pressure there. And how do you prevent it? I don't know how you would prevent it, because if I did, I would have done it. But the research that I've seen as of now, you get these pads that you could press down on. I'll leave the actual name of it down at the bottom, and it's supposed to help. So I think it's silicone. You put it on your area to help reduce it. You put pressure on it to reduce it. Some people try aspirin rubs. There's the surgery option there, but they said with surgery there's a chance that it'll come back because it's genetic, right? So if you had surgery in the first place and you got keloids, you want to get surgery to remove the keloids, which is also trauma to the area, which could cause keloids, right? The business of surgery. Or you can get injections, so surgery or laser. They can laser it off. But their chances of that coming back as well. So it's like, what can you do? What can you do? Does it show in bikinis? No, it doesn't, because it is below the line, the bikini line. However, it's not flush because of the keloids, so it still bumps out and it's irritating. Anything too tight irritates it. So I'm going to show you guys what it looks like now so you guys can see it. Okay, so bear with me. So this is my C-section. See how far it sticks out? It sticks out. And it has the grooves in here, here. This part's the biggest. And then it has it in here. So this is the blister. That's the blister. But yeah, this is the keloids. My line didn't go away, but that's still there. So it's hard to get under here, so you have to get under and over. So when I'm cleaning it, I have to make sure, because it's like a fold, you know, like a belly fat right there, right? So you have to clean it, you have to go under. That's my experience a year later. I was trying to, the reason I want to do this video is because I'm trying, when I was going through this, I was searching online, and like everyone I saw was flat, 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 flat. And I was like, what is wrong? Mine is infected. What's going on? Talked to the doctor. No, it's just normal healing. It's just look like it's going fine. And so there's only one other person I saw on YouTube that had something like mine, but hers is gone now. Like, she had a year, and 2 years later it's gone. So I'm praying that mine just disappear. But the research I saw said they don't just go away. So she must have did something. But yeah, so this is for those women out there who are just a little bit different than others, right? Who are looking online to say, okay, am I still normal? Right? Because we are still normal, but we just heal a little different. And yes, it costs them, I see it, and it's like a blemish, and I hate it, and it's the worst. But Amelia's healthy. She's okay. So that's good. She didn't have to go in the NICU or anything like that. So that's the bright side. But for me personally, about my self-esteem, because I was bored flat. Washboard, right? So for those of you who can relate, not just necessary to the washboard part, because you don't have to relate to that, but to those who can relate that their area was flat and now it's completely different, and you have some self-esteem problems for it, you're not alone. You're not by yourself. So that's the reason why I want to put out this video. I know it's maybe a little bit long, and I apologize, but there was a lot to go over for a year because it's not easy. It's not easy at all. There's this, so there's another lady I was watching. I just want to add this little side note. She mentioned she lives in, I think in Britain. They have midwives and stuff, or Canada. I don't know where she lives, but their hospital provides them with midwives if they choose to, free. It's part of their stuff. And she said there's this thing that's called desensitization treatment for your area, which you start off with your fingers, right? Because you're trying to get the nerves back. Then you take some cloth and lightly do it, and then you do it a little bit harder every time. So desensitize that area so that way it's not sensitive anymore, and you're working on that nerve connection, right? I didn't know this. Why don't your doctor should be telling you this. Like, okay, you need to do some desensitization treatments for your C-section scar. There's also workouts that you're supposed to do for C-section recovery that they didn't tell me about, right? So look those up, guys. Look up desensitization C-section and work out with the C-section so that way you help it. And don't forget to work out your pelvic floor because, you know, everything, even though you didn't have a vaginal birth, those areas still needs to be tightened up because, you know, the baby head put pressure on there regardless. But with that, guys, if you have any questions or any comments, please leave them down below. I answer them as best as I can for my best of my knowledge that I can. And don't forget to hit that like button, subscribe so you won't miss out anything else. And I'll catch you guys on the flip side. Bye.